Hi everyone, welcome. Thank you for joining us today. Just a quick intro for those of you who may not have met Jen, although many of you probably have. I actually personally met Jen some 20 years ago, potentially, working while she was doing her clinical trials for her mineral block and on one of the studs there, and I've been with her now for 5 years. Jen, after doing her studies and travelling the world and research and working in many of the different countries, grew a passion for clinical nutrition and putting the treatment and management and together with a lot of veterinary conditions. With that grew what you see now is Genequine and some of our products. As you know, we're here today to talk about equine metabolic syndrome, so I'll pass it over to Jen and we'll get started.
Alrighty, well, we're still seeing a lot of laminitis, especially this time of year. But the recent work coming from Kathy McGowan and her group and other researchers is that more than 90% of horses that present with laminitis as their primary clinical sign will have developed it as a consequence of endocrine disease, most commonly equine metabolic syndrome. So that's what we're going to talk about today. I'm going to talk about how to manage them with diet and exercise as that underpins and it's the cornerstone of successful, hopefully in a lot of cases, prevention, but certainly in management. So equine metabolic syndrome has a combination of insulin dysregulation, obesity, and laminitis. The adipose tissue secretes adipokines and cytokines, notably tumor necrosis factor and interleukin-1. And what these do is cause local and remote inflammation, dysregulated local glucocorticoid metabolism, oxidative damage, lipidosis, and impairment of insulin signaling within fat, muscle, and the liver, which results in whole body insulin resistance. There's some evidence, and it's certainly being looked at in depth now, that the neck crest adipose tissue is more active than a mental fat, and that's similar to humans with their belly fat having a different sort of biochemistry and physiology than other peripheral fat. Now, you probably, this is nothing new, that sustained hyperinsulinemia can cause vascular dysfunction, and that basal unfasted hyperinsulinemia is a predictor of incipient pasture-associated laminitis in ponies. And this is such a good finding, really, because it means that a lot of the complicated testing for blood glucose, we can actually do more simple tests that give us a little bit of insight rather than having to go to combined insulin and glucose response tests. So this work's also found that laminitis can be predicted by any 3 of the following 4 criteria. So a body condition score of greater than 7 or greater, and that's using the original score out of 9. A CRESTY neck score. Now, the CRESTY neck score, there's some literature showing that a 3 or greater out of 5 is a bigger risk. Some people say 4, but it does depend on the type of horse. So I think if you see a 3 out of 5, it's time to act. Basal insulin over 32 micro international units per mil, a leptin of over 3.7 nanograms per mil, but the basal insulin alone, the unfasted hyperinsulinemia of greater than 32 micro international units per mil predicted laminitis as accurately as the combination of criteria. And that's good from one point of view, in that your body condition score and CRESTY neck score are, right up there in terms of predicting an incipient episode. So the difference between laminitis caused by systemic inflammatory response syndrome and laminitis due to equine metabolic syndrome is that the primary insult to the hoof in the equine metabolic syndrome is an alteration in the form and the function of the vasculature to the foot rather than in a generalized systemic inflammatory response syndrome. Now, it's unclear how this primary insult occurs, but there is a lot of work being done on it. But the high insulin concentrations are thought to affect blood vessel tone, resulting in altered blood supply to the hoof. There's also some evidence that insulin itself, through the action of insulin-like growth factor, has a direct effect on the epidermal cells in the lamellar tissue. So it is a bit different pathophysiologically from the systemic inflammatory response syndrome forms of laminitis. Another difference between endocrinopathic and systemic inflammatory response syndrome laminitis is that the rapid disruption of the basement membrane does not occur either in models or in naturally occurring cases of the EMS. The other thing is that EMS can actually have a prolonged subclinical phase and there will be histological and growth changes, whereas that prolonged subclinical phase, this doesn't usually occur with systemic inflammatory response syndrome laminitis. And the EMS horses can have painful or non-painful bouts of laminitis for many years before it's diagnosed. And that's really critical, because one of the hallmark identifiers we let clients know is, this typical sore horse with laminitis that's leaning on its back legs and feet and trying to get the weight off the front feet. If these EMS horses have non-painful bouts of laminitis, it's going to be very difficult to identify them. So if the underlying metabolic syndrome remains unmanaged, then it's very likely they will continue to have repeated bouts. So how do we diagnose EMS on body condition, on physical appearance? Well, certainly the body condition scoring, the cutoffs of 4 or 5 out of 5 or 7 to 9 out of 9. But body condition score has a significant limitations. It was developed to monitor fat depositions in pregnant quarter horse mares, and it doesn't suit every type of horse. And also, once body condition score gets over the 5 out of 9, it has a non-linear relationship with total body fat. There's also huge variations in owner understandings, and certainly in pony club horses, 40% of people underestimate their horses' body condition score. And so it seems like their simple, objective and repeatable measures such as body girth are more accurate in moderate to obese horses. And that's not really terribly scientific or difficult, because it's just like seeing if you can get another belt hole in your belt buckle, and it's as simple as that. There's also ongoing research showing that CRESTY neck score is also a useful indicator of regional adiposity. So let's have a look at the CRESTY neck score. If any of you want the body condition score, it's the original Henneke one. There's been one adapted by Huntington and Carroll, which has a range of 1 to 5, and I'm sure you could still go 1, 1.5, 2, 2.5, and you'd get up to the score of 9 anyway. So there's plenty of literature on that. But the CRESTY neck score isn't so well published. So a score of 0 means there's no visual or palpable crest. Score of 1 means no visual but slight feeling of a crest, feeling on palpation. A 2 is a noticeable appearance of the crest, which is pretty evenly distributed from the poll to the withers. It can be easily cupped in one hand and it's fairly soft. A 3, when the crest enlarges and there's more fat deposition in the middle of the neck than either end, it pretty much fills your cup hand and it's not quite as soft and flexible. 4, the crest is grossly enlarged and thickened. You can't really fit it in one hand unless you've got really big hands, and you can't really move it from side to side. It's becoming quite firm, and it might have some creases perpendicular to the top line. And number 5, which we've probably all seen and certainly seems to occur more often in donkeys, is where the crest is so large that it permanently droops to one side. Here's a picture of it all. The CRESTY neck score 2, we're probably all familiar with those, but hopefully not so familiar with number 5. So that's a greater predictor of insulin resistance than is body condition score. The other measurements which are used in research are the width of the rump. Some of us probably do that when we can't pull our trousers on anymore. It's the rump width, so it's a simple linear measurement. The height of the crest, the neck circumference relative to the height ratio, and the belly girth. So these are just, they're not difficult. They're sort of objective and reliable and repeatable, but they're mainly used in research. And but if you've got an owner who's really anxious about, you know, seeing any weight loss, to encourage them to keep going with what are often difficult management changes, just a simple measure of those things can encourage the owners and show up changes that can't be seen with the body condition score. Now, how to do it? Well, before going to metformin, the cornerstone is dietary modifications and exercise, both to reduce obesity and to improve insulin sensitivity and reduce the basal fasting non-fasting hyperinsulinemia. The correct diet and exercise, if you can get good owner compliance, you should see an improvement in glucose and insulin within 6 to 8 weeks. So, as I said, we've probably all experienced this, but you know, the owner compliance, and it's really important to know the current feeding regime, how they manage the horse, what yards and electric fences or shaded paddocks and things that they've got. And if you can sort of work an individual program, then the owner compliance will be much better. And of course, that means response to treatment will be better. Simple rules are: remove any concentrate or manufactured feed based on bran, pollard, mill run, etc., or containing molasses, and obviously also any grain feeds. They can't have sugar treats like apples or carrots. The hay has to have a low NSC. Sometimes that's provided with the batch of hay. So, but you know, I think soaking the hay is better. For an hour in cold water, it will reduce the non-structural carbohydrates, which is the starch and sugar, by 30%. And if they switch at 8 to 16 hours, it'll drop by 50%. It also reduces mineral levels, so supplementation is necessary. Now, there was a myth going around that feeding soaked beef pulp led to liver disease, but it wasn't the soaked beef pulp. It was that the people had left it soaking for 48 hours in warm weather, and so the mold growth had some hepatotoxicity. So it's really important in warm weather that they do manage that sensibly. So current recommendations: take the horse off pasture. Ponies can eat 40% of their total daily requirement in 3 hours. They do take faster bites. There's somebody studied the bite size and the bite frequency, and if ponies know they're not going to, if they've only got limited access, they will just eat constantly. It's also better not to have straw bedding, because you know a lot of them will eat that, although as discussed later you can feed some straw. Providing hay, start at 1 to 1.2% of the current body weight. Now there's lots of formulas, you know, if you work out what the ideal weight is and work out what the current weight is, and you know, feed a percent of the da-da-da, but you know, if you just start with the hay at 1.2% of current body weight, and there are nomograms that will enable you to get the current body weight. Think of any strategies you can to prolong feed intake, or even provide some entertaining things in, like safe branches or toys for them, so if they're going to get bored. Now the forage-only diets don't contain adequate protein in terms of the essential amino acid profile, minerals or vitamins, and so a low starch balance so that supports hoof repair and building is recommended. Now the exercise part of it. This can be more difficult, obviously, but some of the owners might enjoy it anyway. You can take them for walks, but Moderate exercise without diet restriction does not mitigate the insulin dysregulation or insulin resistance in overweight and obese horses. So the general rule of thumb is to start with 2 to 3 times a week, 20 to 30 minutes of exercise, and they can be ridden or lunged, obviously depending on their integrity of the lamina, and then that can be gradually increased. Now, even this recommendation doesn't help you answer the questions you're probably going to get from the owners. So on the next slide, we're going to go through some of the exercise regimes and what the recommendations are. So as soon as the horse is comfortable and off analgesic and anti-inflammatory medication, as long as there's appropriate sole support like a sand guard or some, farriery for the condition, they can start. So there's limited evidence as to what the best protocol is, but there is research that's showing what has and hasn't worked. So that's what I'm going to give to you, but I can't give you a black and white formula either, but at least it's a starting point. The exercise should progress up to 15 minutes of trotting per day, and that will help maximise the glycogen use. As I said, light exercise without diet restriction is not going to be sufficient. And also it's important to remember that if horses are removed from the pasture and put into confinement, that can be a trigger factor for laminitis and EMS horses, and it may well be the reduction in travelling. And there are systems where, automated systems where you can put a little feed hopper at one on another end of the paddock, and every few minutes one of them will drop a bit of feed, so the pony's got to walk up and down to the feed or the feed and water, and that's been shown to increase exercise by 3 times. They increase it having to walk to feed and water. So here we've got the exercise intensities that have been shown to improve insulin sensitivity. And often, as you'll see in this slide, they're often more than what people think they can do. So low intensity, the definition of low intensity exercise is that they should be producing a heart rate of 110 to 150 beats a minute. Your owners may not be able to measure that, but some of them might be able to take a pulse. The definition of moderate intensity of exercise is a heart rate of 150 to 190. And for inactive or lightly exercised horses, fast trotting on a lunge will bring a heart rate of 100 to 110, and a canter will bring it up from 120 to 160. So you can see that fast trotting on a lunge is not going to be sufficient to affect the insulin sensitivity. It may assist with some weight loss, but often people do need to exercise them more than they, harder than they think they're doing. People always overestimate how intense the exercise is when it really isn't. Thanks. So the key recommendations are, you can make the decision based on the lamellar stability and the response to exercise. If they become sore, obviously it needs to be cut back or the footing needs to be changed. But in horses with insulin dysregulation and no laminitis, the low to moderate exercise, which is a canter to a fast canter, they can be ridden or unridden, and you want a heart rate of 130 to 170 for 30 minutes 5 times a week. If they've had previous laminitis and the lamella are unstable, you'd start with low intensity exercise on a soft surface, so a fast trot or an unridden canter, taking the heart rate from 110 to 150, 30 minutes 3 times a week. For older horses, they can do moderate intensity exercise for 20 to 30 minutes 7 times a week with a heart rate of around 160. Obviously, that's not for very geriatric horses, but as they're getting older, they can still handle a good amount of exercise, which, if you think about it, is what happens in nature anyway. As I said, there are walkers and track grazing systems that can be used to increase the exercise, such as putting the feed up one end of the paddock and the water down the other, or feeding in different positions in the paddock, just small amounts, so they have to walk from feeding spot to feeding spot. So why doesn't exercise work? Well, if the exercise is too low in intensity, you're not going to activate the muscle and fat and liver group 4 transporters, which are required to change the insulin sensitivity. So when horses do 30 days of 30 minutes of light exercise with a heart rate of 130, this study was done in obese mares, and they did get short-term improvements in insulin sensitivity, but once the exercise stopped, that sensitivity reverted to resistance. In another study on obese ponies, working for 6 weeks, 5 days a week, 9 minutes trotting and canter with a heart rate of 140, they had only a marginal improvement in their oral glucose tests. Another group of horses had 2 weeks of 30 minutes slow trotting 4 times a week, plus 2 weeks of 30 minutes of trotting twice a week, plus 20 minutes of slow canter and 10 minutes trotting twice a week, and that had no effect on insulin sensitivity. So I hope the previous slides provide some useful practical starting points. Now, how much to feed? Well, if horses have ad-lib access to feed, horses will eat around 2 to 2.5% of their body weight per day. Ponies can eat up to 5%. So they do really all have eating disorders. Now, if you're looking for weight loss, then as I said, you start with the current body weight and feed approximately 1.2% in dry matter weight of that. So if the pony weighs 400, you start giving it, making sure it was having 1.25% of that in kilos today. It's not recommended to go less than 1% of body weight because of problems with hindgut function, hyperlipemia, protein restriction, and stereotypies. So we start, this is a study on ponies, and the results have been similar in several studies, and they started with 1% of the existing body weight, which equated to about 70% of the maintenance intake. When that was done, the Shetland ponies lost 1% of their starting body weight when the digestible energy was 70%, and then it was dropped down to 50% for another 3 months, and then 35%. And they were fed a mixture of 50% lucent and 50% straw with a vitamin, mineral, amino acid, biotin, little concentrate supplement. But some horses will remain persistently hyperinsulinemic despite weight loss and tight dietary control, and these horses are intolerant of even small fluctuations in pasture or hay sugar levels, and they may have to be permanently off pasture, fed hay with a low sugar starch content, and just ideally I like to see them in a sandy area so they've got good support. But sadly for some ponies, they can never go on pasture again, and unless the NSC is known or it's particularly it grows in the shade. And again, in our laminitis webinar, we went through that 3 a.m. to 11 a.m. is probably the safest time for sugar levels. But some horses will not be able to go on pasture again. If the horses are kept on pasture all the time, weight loss programs and exercise can be difficult and unrewarding because we don't know how much they're eating, and unless you run around measuring sugar levels throughout the day, we don't know how much sugar they're consuming. So for difficult ones, it's really often best to confine them at the beginning of the program. Some can be returned to restricted grazing using pretty bare paddocks or yards if people can round up or do some sort of control. And don't forget to control the weeds as well, because a lot of them are very palatable and they can be really high in sugar and starch. They can go on a sand menage or the grazing muzzles after the insulin is normalised. They can be returned to restricted grazing. Strip grazing or short periods of access to grass can be counterproductive. As I said, ponies with restricted grazing will very rapidly compensate and can consume up to 50% of their daily dry matter intake in just 3 hours. So how do we monitor the response? Well, there's a couple of studies been done, one with 12 obese, insulin-resistant Arab geldings they were exercised for 8 weeks with 4 sessions per week of moderate intensive exercise. Now, over that 2 months, they had a 4% reduction in body weight, 35% reduction in fat mass, but there were no changes in glucose and insulin dynamics or plasma hormone and lipid concentrations. In another study of 3 obese thoroughbred mares, they were trained 15-20 minutes a day in a round pen, and they improved their insulin sensitivity but had no change in body weight. Now, as far as using body condition scores to determine body weight loss, it's really not useful at all. As I said, it was the body conditions. The original one was designed to estimate how fat pregnant quarter horse mares were getting, but it's not really very useful as an indicator of weight loss. In a program with 12 obese ponies went on a weight loss program with exercise and diet. They had a 12% fall in their body weight. They had significant reduction in heart and belly girth and a significant decrease in rump and rib subcutaneous fat depth, but there was no change in body condition score or neck circumference. Current tests which are useful, and I've put a link to the Tufts Equine Endocrinology group, which puts out a lot of really useful information and have conferences, and I put a link there. So the dynamic test of the oral sugar test and the insulin tolerance test, and there's details on those at the website there. But it's also useful to measure resting non-fasting insulin concentrations. So I hope that information is useful for you. Certainly they'll feed all 4 feet. Some people think I called it awful feet, but it could be called that, I guess. But we've formulated it really for horses and ponies, not just with endocrinopathic equine metabolic syndrome, but also many different veterinary conditions, because horses just need the same good quality diet. The amount of nutrients varies, but there's certainly some things that they don't need. And the awful feed's fed in like 50 grams for a miniature pony, and maybe 1.5 for a working stallion. It's a feed that I've used in Japan and New Zealand, and it avoids all the common pitfalls, and it can be used to replace or boost levels in manufactured feeds where the recommended minimum intakes aren't being met. It can be used to replace balances, amino acid supplements because it is packed with amino acids, hoof supplements because it has a very high level of biotin, the level that's been shown in research, veterinary research, to affect hoof quality. It's also got probiotics, and it can be used to replace a lot of tying up supplements, and used for horses with any condition where low starch sugar is indicated. So this is an analysis of the awful feed. It's got very low levels of starch, sugar and non-structural carbohydrates, so it's especially suitable for a lot of veterinary clinical conditions where you want good nutrition, you're repairing tissue or trying to build muscle, and it is suitable for all horses. I mean, a lot of people think, well, how can a 2-year-old racehorse be fed the same thing as a pregnant mare? But both of them are actually growing tissue and repairing tissue. They're growing muscle and bone and blood cells. The mare is growing the foal, and the 2-year-old racehorse is trying to increase its body mass while it's training. So it can be used across all the different breeds and disciplines, and it does help reduce the number of feeds you've got to have in the feed room, and it, except on veterinary advice, eliminates the need for multiple supplements. We also have a product, Easy Mag, which magnesium's been found to be involved in insulin metabolism and activity, and magnesium has a role in many different equine veterinary conditions, and it's very difficult to diagnose magnesium deficiency, but certainly, and the clinical signs of the borderline deficiencies are very vague, but certainly within, within a month to 3, if they have a magnesium supplementation, there should be an improvement in a lot of these signs.
The other thing we offer is a diet analysis service. In a lot of diseases, we need to know the diet so that we can make sure it's optimum. And a lot of the diet, the spreadsheets and the generic things are based on NRC requirements, and these are minimum recommended intakes, and they're now over 13 years old, and there's certainly been a huge amount of research which shows us from a veterinary point of view a better way to feed horses than with minimum recommended intakes. So that's what, and I've been working internationally and as a horse vet for 25 years, and still consulting and working as a vet in different countries in the world. And I just love doing diet analyses, because really if the basic diet's right, there's no point in chucking a whole lot of supplements. So that's our diet analysis service, and it is personalised. I do it myself, and I write the reports, and well, I'll certainly be happy to speak to you once you receive them.
Opened up a Ask Dr Jen form on our website as well. So we've got a section for vets as well as a section for horse owners. So if there's at any time there's a question that you've got or a case that you'd like advice or help with from Jen, if you go into our store, it'll say Ask Dr Jen for veterinarians. Click on that, fill in the details, and Jen will be able to respond back to you via email, or if you prefer a phone call, then Jen can give you a call. But yeah, we're just trying to open up Jen's availability and her help and advice to horse owners and veterinarians. So yeah, if you've got any feedback or questions, just let us know. Jen also contributes articles to a range of magazines, articles in the Equine Veterinary Association magazine, Hoofbeats, with that also get EVA approval, ProVet, Partners in Practice Issues, Equine News, Australian Quarter Horse magazine, Equestrian News magazine, as well as the Pony Club Australia newsletter. Jen is also currently rewriting and reviewing the certificate, the A certificate and the B certificate for Pony Club as well. So that'll be a big help for Pony Club, and also be good to update all the information that they've got and with their Pony Club members. Also, all the articles are available on our website that can be shared through clinics, on social media, and in your own newsletters and things like that. So, and if there's also a topic of interest that you'd like Jen to look at, or we may also have that's not available on the website at the moment, let us know and we can get that sorted for you. So on our website also, we have our online store where our diet analysis can be ordered. The send a free Ask Dr Jen request can also be ordered from here. So there's a veterinary version as well as a horse owner version, and also ordering products and merchandise can also be done on our store. We have an ebook available that has our products in it, as well as scientific references backing our products. That's available online or in a hard copy form that some of you may already have, and if you need more copies, we can send them to you, so let us know. But that's a handy little book to have for hand to your clients, or even for yourself if you like.
That we've got a few general public customers on here, but we've also got a few people that own stores that do stock our products. If you ever need any assistance with any images or anything that you'd like to put up on your website or on your social pages so that your customers know where they can get the products, we can help you out with that. And by the same token, if you're a customer and you have any problems trying to locate any Genuine products, or are curious as to where would be the closest to you, by all means you can email us, or you can contact us on any of our social pages. So we do have an Instagram page and a Facebook page as well, and that's where you'll be asking me.
Yeah. All right. Well, thank you all very, very much. And I hope you found it enjoyable. And please feel free to call us anytime. We're here to help.
Thank you.
Thank you. See you later.
Bye.